We turn now to the Democratic Republic of Congo in efforts to contain the Ebola outbreak there. In the last few days, 3 treatment centers have been attacked. This includes 2 that were set on fire. The first was on Thursday. We talked to you about it then, after family members were banned from retrieving the body of a man who had died from Ebola. I want to bring in CBS News medical correspondent Dr. Céline Gounder. She's an infectious disease specialist who spent time in Guinea as an Ebola aid worker during the West African epidemic. Dr. Gounder, I just want to open a broad area of conversation. What did we learn over the weekend? What are you watching? Separate the signal from the noise.
Well, I think we're seeing some of the same patterns as we saw during the West African Ebola epidemic, and for that matter, actually during COVID. So I think if you think about how people resisted wearing masks, how they resisted getting vaccinated for COVID, it's a lot of the same reasons of not trusting the messenger, the person who's advising these measures, and also feeling backed into a corner and feeling like choices are being taken away from you. And what we're seeing in country on the ground there are a number of different reasons for distrust. So first of all, you have Rwandan-backed militants, the M23. The local population perceives the Rwandan-backed militants as being aligned with U.S. interests. They are stealing, robbing natural resources, minerals, that kind of minerals that go into your cell phone, for example. And so there's tremendous anger over that. The U.S. pulled out, USAID pulled out when the agency was dismantled last summer. USAID was supporting much of the healthcare system locally. And then you have fear of the measures being taken. So when you see healthcare workers becoming sick with Ebola, when you see them dying, the last thing people want to do is go to a healthcare facility, including Ebola treatment units, when they're sick.
And how are the metrics, the numbers landing with you? Are they alarming to you? And when we talk about risk profile, the World Health Organization said now 10 African countries are at least some level of risk. That's a higher number than Friday. What do these things tell us or suggest?
I am alarmed. I think this is going to be at least as big as the West African epidemic of 2014 to 2016. I think in addition to many of the same risk factors, we have some additional risk factors, including the armed militants that I spoke about, as well as refugee camps in South Sudan. So this has the potential to be explosive. We don't have vaccines or specific treatments to control this. And I think the key number here is actually not the number of cases or deaths we've seen so far, but the number of people who are getting contact tracing. So that's following them for 3 weeks if they've had a high-risk exposure, to see if they develop symptoms, to diagnose them if they do develop symptoms, to get them treatment. Only 1 in 5 contacts are getting contact tracing right now, which means that we're very much behind.
I don't know if this is relevant at all, Dr. Gounder, but I'm going to ask you. The World Cup is coming up. That is a transitory event, meaning lots of fans get on planes and they fly to America, Canada, or Mexico. Should that in any way be part of our risk assessment?
The World Cup, this coming World Cup, is the largest mass gathering in U.S. history. Unfortunately, the U.S. government has not allocated additional resources for health preparedness. They have allocated $625 million for law enforcement and physical security, but not for outbreak response. And frankly, it's not Ebola that has me worried. What has me worried for the World Cup would be a measles outbreak or MERS, which is another coronavirus that has the potential to spread person to person through the air. So hopefully, fingers crossed, this is an uneventful World Cup, but I am concerned that there hasn't been more effort to prepare for this.
Dr. Céline Gounder, great stuff as always. Thank you very much.